What is going on? So most likely if you have clicked on this video is because you are having some issues with the sciatica nerve, or you've been diagnosed with the problem with the sciatica nerve. You've tried nerve flossing. I don't know actually how you do it with the head. Okay. You've probably followed as well some advice of stretching to relieve the pain. Well, in this video, I will explain you, in my opinion, in my vision, what is the sciatica problem, okay? And I will give you a program that you can follow where you will not have to jump back and forth to follow this guy, this girl, this one, and all my advice will be based on myofascial release and using the normal body mechanic that you can use on the everyday life, okay? So without further ado, let's get started. Okay, so I will try to make this video as simple as possible for you to understand. The sciatica nerve, where does it start, where does it go? L4, L5, S3, S2, S1, along the glutes, underneath the piriformis, down the leg, going through the hamstrings and the calf and the foot. This, you probably know that already. I guess you've done your research or a professional already told you that. I want you to imagine something now. Let's say that this nerve is a hose, okay? And this hose, somewhere along the line, and maybe the structure as well, the tap is closed, meaning that the water is not running. So this program I've made for you will be in two phases. First phase will be releasing tension around your leg and around the pelvis. I'm going to show you right now the beginning with the calf, okay, and the end with the lower back around this area here. For the rest, there will be videos down in the description below for you to check. Okay, this is the first phase. Second phase, I want you to start doing movement that we as human beings are supposed to do more. What are these? A spine to be decompressed needs to have more rotation, side bending, flexion and extension. If it doesn't have that, or most likely you haven't been too active, or you're active but you lack this movement in your trainings, this is what I will show you. It's going to be of hinging, shifting the hips back in order to fire up the posterior chain, and this movement here. This also will be in the description below for you to start your journey in order to get rid or improve your state that you are having right now with the sciatica pain. Okay, so for the first release, we're going to do the calves, okay? You've got two main muscles, the two main gastrocs that we're going to try to split and just roll down to the soleus here. Simple as that. You put the ball in between, put the other leg above, and you can just, with your two hands on the floor, lift your butt a little bit and just roll in the same area, looking for some tight spot, looking a bit more on the side, and then you go a bit more down towards the soleus with the ball. You roll. You see now I'm just moving my hip there on the floor, and I'm just gently from the spot. You can stay on the spot, move your foot up and down. And you're going to go like this down to the soleus muscle, where the soleus starts and the finishes and the gastroc starts, okay? So you're going to be here and enjoy it. It's going to be painful. You will enjoy it at some point, and believe me, the pain will reduce as well at some point the more you do it. A tennis ball will do, something flat, something round as well, that will do too, okay? Be creative, and yeah, that's it for the calf. Okay, so now for this release, we're going to do the lower back. Do not butcher yourself, be gentle. This is the size of the ball that you want, and the position that you're going to have, I'm going to show you from the side like that right now, and facing this way. I'm laying flat on the ground. I want to put the ball just where the iliac crest is and the spine meets, just right here, like it is on the drawing for you to see, okay? I'm laying down, the ball is right there, and what I'm doing now is I'm moving my pelvis posteriorly. So I'm going to bring my tailbone in and out. I like to start is I like to start with the ball touching gently the spine and in between the muscle and the spine, and I go up, and afterwards I go around this area and I go up around here, but I go very easy. I don't try to put much pressure. Okay, so now in this position I'm here. I can bring my tail in to put a bit more pressure on it. That's good. Now I'm in between the spine and the muscle. Then I'm going to lift my butt, go a little bit more on the side. Okay, and I can play around. I can put my leg here. Up, you don't see me. Put my leg here, and you can probably see the ball here. See the ball, and then lift my butt and put a bit more pressure and just gently roll on the same spot, you know, and relax. This is it for now for me to show you about the releases. Do these routine that I have described in the link below for at least 2 to 3 weeks. Don't push it, don't rush it. Learn, feel your body after every release, after every movement. Make sure you do it before and after to see what impact the releases or the movements have on your body and how does it feel. Okay, so I hope now that I've equipped you with some tools to fix or to actually get some relief or improvement on your sciatica problem. And remember, you know me by now, you just started with me. I'm James, body therapist and breath coach, and I'm not here to just say do this, do that, to give you quick fixes. No, I like to teach people and I like to empower them to go towards a better life, pain-free, of course. If you like this video, don't forget to subscribe. If you like this video and like the channel and would like to support me as well, which is super cool, I always feel super appreciated as well, there's a link below to support the channel. Until then, keep it up and get ready for the next video.